my dear Dr. Mishra, my dear Dr. Chauhan, doctors from abroad and India, ladies and gentlemen, it is my profound privilege to have with you on this afternoon. I felt very happy to listen your experiences of 15 days, your learning abilities during this 2 weeks period, and your own assessment about your teachers. Few of you have explained what is a teacher, who is a teacher, and what impact he can leave on the minds of learners. You may be aware that teaching, like any other thing, is a double-way process. The teacher perhaps learn more from you because teacher is single in the class or in his laboratory, whereas number of students or learners is more. Their experience is definitely much more than the teacher alone. So it is a two-way process, and this process makes a perfect student. One of the participants has very candidly stated that many people, they have a tremendous amount of knowledge, but they don't have the ability to transform that knowledge or to convey that knowledge to the others. And I am really very happy to know that Dr. R.K. Mishra is a qualified person on that score also. No, indeed, Dr. Mishra has many firsts with him. He is not only a laparoscopic surgeon. First, he is a best human being, perhaps you might have not seen so far. You see, he is so accessible. Even if you want to ask anything, even while he is walking on a road or he is going in his own car, he will not hesitate to interact with you or give you the advice. Such like people are very rare. And so, you see the case is with Dr. Chauhan also. It is this attitude of the institution or the people who are working in that institution who makes better persons. Now, you have learned various techniques, and you yourself have assessed that you have learned the fundamentals of laparoscopy. About 50 years back, laparoscopy was just treated as a skill, and it is a sharpening of skill. But now, it has gone little above and attaining the stage of a special branch, a specialty. And if your fundamentals have been cleared, you feel very confident to operate upon the patient, then you have certain responsibilities with this expertise that you should keep yourself up to date, because on every day technology is changing. Robotic has come to the service of mankind. So after getting your fundamental clears, please don't stop it there. Go a little ahead. Try your hands on the robotic surgery also. And another point which I want to emphasize, the best approach of learning is interaction. You cannot learn much more from the books. Books are very boring for everybody. Whether he is a doctor or he is an engineer, or he is an administrator, or he is a scientist. But discussions, interactions can make a man more valuable in his knowledge. Now, internet is there. You can interact, or you can create some sort of your own society or a gatherings or a club. And through that club, you can keep yourself abreast with the various techniques of laparoscopy from time to time. And another things, you see, when during our days, we always considering a teacher just like a father, and a doctor is treated to be next to a god. Now with the modernization, globalization and materialization, the reputation or the status of teacher as well as the status of doctor has gone little down. And there may be many reasons, and every doctor or teacher may not be like that. But in the society, the value is coming down. Now it is up to you to raise your value, to raise your status again in the minds of the people which was earlier. Because it is a doctor who gives the life to the dying person. So after having your 2 weeks or 4 weeks training, what the knowledge you have got, you have become empowered. Knowledge is power in all respects, in every sphere. So with this training, you have become empowered. Please use this empowerment for the welfare of the society. And wherever possible, you can also subsidize your charges for the patients coming from the poor section of the societies. Now, one of the participants was a little feeling homesick because his spouse was at home. Now, I would like to request the management, particularly Dr. Mishra, that he should also make some scheme or make some provision in his training programs. Those who want to come with a spouse, they are most welcome, and subsidized their accommodation. So this will help both of them and others also. So this is the suggestion at my own I would like to give to Dr. Mishra and Dr. Chauhan. So with this, I once again thank you all, particularly Dr. Mishra, Dr. Chauhan, and members of his team. But I am feeling in my address, if I will not thank to the real power, real strength behind Dr. Mishra, and who is Sadhana Mishra. I thank her also. Thank you very much.